And I'm Alfred. All, welcome to this, what's going to be the final video in our health topic from Unit 3, and we're going to be looking at our third disease case study, which is HIV/AIDS. Now, to start us off, as we've started with all of our disease case studies, we look at distribution. Now, HIV/AIDS is found most predominantly in Africa, particularly Southern Africa. However, we've discussed this in class, that HIV/AIDS is not a disease that is limited in its spread to any particular geographical area, but there are some factors that mean it spread more easily in Africa than it would have spread in other areas. So what are these factors? What affects its distribution? Now, first, HIV/AIDS is spread by blood or body fluids of a person who's got the disease. So HIV is called the human immunodeficiency virus, and it goes on and leads to AIDS, which is acquired immunodeficiency syndrome. So first, HIV is a virus that lowers your immune system. It means your immune system is less capable to fight disease, and then an accumulation of other infections can have a huge and deadly impact on a person. The things that kill people as part of HIV/AIDS are viruses and infections that most people who are healthy with a fully functioning immune system would shrug off pretty easily. But what actually leads to prevalence of HIV/AIDS in particular geographical areas? First, how is it actually contracted? So the three main ways that we have HIV/AIDS spread is sharing needles, unprotected sex, and babies drinking the breast milk of an infected mother. In Africa, and developing nations across the world, but certainly the African nations, there are more cases of HIV/AIDS because more people live in poverty, and because they live in poverty, they're going to be malnourished, and they're going to be more prone to suffering infections anyway. And because they're more prone to suffering infections, HIV will transition into AIDS a lot more quickly and become a lot more devastating. We tend to also find that there's less health education in these areas, so people have a lowered understanding of what HIV/AIDS actually is and how it spreads. And we also see a lot more wars, civil wars and conflict. And what these bring with them is poverty, malnutrition, and also an increased instances of rape. And because we see all of this happening, and increased rape as well, then we've got a lot more people who are going to be contracting the disease. Now, impact. Now, again, this is went the wrong order. So if I flick back, and it's all went wrong. But if I flick back, so in 2010, 69% of all HIV/AIDS sufferers lived in Africa. In some nations, you had 1 out of every 3 adults had HIV/AIDS, 33% of the adult population. Now, issues. Prevention, detection and treatment of AIDS is expensive. To treat every AIDS-infected person in Africa, it's estimated that it would cost more than what the entire continent currently spends on healthcare for everyone. In some African nations, over 1/3 of all hospital admissions are related to HIV/AIDS. The kind of horrible truth with this is, the more money you spend on treating people who've got HIV/AIDS, the less money you're spending treating people who are suffering with other health issues. And particularly in nations who don't have huge amounts of money, they don't have huge budgets to spend on healthcare, decisions need to be made on how the funds get allocated. And the reality is that HIV/AIDS would swallow most African nations' health budgets to a huge extent. One of the other big impacts, when an adult falls ill because of HIV/AIDS, you tend to find that their older children need to become caregivers for the siblings, for their younger children. Now, this means that those older children tend not to finish school. They tend to have to leave school to become a caregiver, which means that they don't get educated. Because they're not educated, they can't go on to have as prosperous careers. They continue to live in poverty. That continues to put them at risk of contracting HIV/AIDS themselves, and this can be a bit of a horrible cycle which continues the terrible impact of this disease. Now, one of the obvious bits with HIV/AIDS is it kills. People are dying younger. I mean, you can look at the graph that we've got here, and it's got life expectancy, before AIDS was a major issue, and after AIDS is a major issue now. And you look, Botswana, you're going from, 72, 73 down to 52, 53. Lesotho, similarly, around about a 20-year drop. Similar in Malawi. Namibia, you're losing about 10 years. Zimbabwe, nearly 25. 20 again in South Africa. People are dying because of this disease. Now, that in and of itself is obviously a huge impact. But that has a bigger impact, again, nationally. If people are dying younger, they're economically active for less time. If they're economically active for less time, it means they grow less food, they create less materials, they do less work. That means the country becomes poorer. It also means there are fewer taxpayers. If there are fewer taxpayers, there's less money for everything, including healthcare. So this has got a huge impact. You're losing that money. It means you can't fight the disease because you don't have the people. And the less you can fight the disease, the fewer people you have. And again, it can be horribly cyclical. South Africa, for instance, is predicted to lose up to 20% of its total income due to HIV/AIDS. That's a huge impact. Now, control. What do we actually do? Now, similarly with heart disease, there's two main methods of controlling HIV/AIDS. You've got healthcare and you've got public education programs. Now, with healthcare, off the bat, there is no cure for AIDS. There is not a cure. There are a lot of charities out there, there are a lot of governments, there are a lot of health organisations doing a huge amount of work trying to develop a cure. But as things stand right now, there is not a cure. There are treatments to manage the symptoms, but there is no cure. Now, for the HIV virus particularly, there are antiretroviral drugs, or ARV drugs, that slow the effects of it and slow your transition from HIV to AIDS. And there are also drugs that can stop pregnant mothers passing the disease on to their children. However, these drugs cost money. They cost money to buy, they cost money to stock. They then also require staff-trained medical professionals to administer. They need to be trained, that costs money. They then need to be paid, that costs money as well. Now, education would seem reasonably straightforward. There's a huge amount of groups out there in the world trying to educate people about how HIV/AIDS is spread. These groups go from charities to governments. It is a huge variety, and they spread this message in a variety of ways. Posters, classes, soap operas, telling people about HIV/AIDS. However, the impact can be limited. In many countries, there's a huge stigma associated with having HIV/AIDS, so people actually just avoid getting tested. They avoid acknowledging that they even have the disease, and because of that, they then spread it further, and their willingness to invest in an education program is much minimised. And in many areas, particularly the kind of poorest countries in the world, a lot of developing nations, literacy rates are poor, so written information, leaflets, etc. are largely useless. You also find in a lot of these countries that they've got a huge number of official languages, so even producing the material in the languages that people are literate in can be hugely challenging. Some areas are just really, really isolated. Some areas are very far away from the nearest town, the nearest city, the nearest village. So you getting health workers or education workers out to these areas is very, very difficult. So the message doesn't necessarily spread everywhere. And in some areas, they are extremely religious. And many kind of major religions, Catholicism, Christianity in particular, teach that the use of artificial contraception, condoms, is a sin. Now, we know that the use of condoms is shown to be a very effective barrier to the spread of HIV/AIDS, but if people believe that using these things is sinful, they won't use them, and that does nothing to slow the spread of the disease. Now, one other bit, and I should have mentioned this earlier in the video, in developed nations, the most common cause of the spread of HIV/AIDS is drug abuse. It's the sharing of needles. Now, I mentioned that as a cause earlier, but it's worth pointing out that, as I've said in class, HIV/AIDS is not a disease that's limited geographically in its spread. It's certainly a bigger issue in developing nations, particularly in Africa, but it is also a problem in developed nations, and the kind of root cause there is sharing of dirty needles. And again, you find that there are programs that governments try and launch to address this. You've got kind of crackdowns on drugs and what have you, but you also find more recently, for example, Glasgow has opened a space for drug addicts to go and inject drugs and inject illegal drugs, but then also giving them the facility to dispose of the needles that they use safely, and they also then provide clean needles. And it's, again, that met with a lot of controversy, because on one hand you've got the argument saying, well, you're encouraging drug abuse, but then on the other hand you've got the argument saying, yes, we might be, but we're trying to make sure that if people are going to do this thing, that we're, the law says it's illegal and we say that it's a bad thing to do, we're at least making sure they're doing it as safely as possible. So there's an argument to be had there. Anyway, there's been a lot of information in this video. Again, go back, re-listen, pause things, take notes. We'll discuss this all in class tomorrow, and I'll speak to you all then. Bye.